Hello, hello. Welcome back. Welcome back, wonderful technologists. Welcome back to the podcast. So, a lot has been going on because life just is lifing. And I'm pretty sure, that happens for everybody. So, unfortunately, I have been a little bit absent as far as doing podcast episodes. I am experiencing a death in the family. So, my grandmother just passed away a few days ago, so I am in the midst of getting things together and traveling at the end of this week. So, if you haven't seen me on social media, that's because I have been just trying to be present with my kids and just trying to not just having the sadness take over and just kind of trying to mentally prepare myself because I know with funerals, we're all a fucking hot mess, right? So that is what's been going on with me. So, a little housekeeping. Make sure you guys join the 3-day live event on how to be the go to CT Tech. I am going to be teaching this very, very shortly. So, make sure you get in the Facebook group. Make sure you get in there so I can teach you my knowledge, my strategies on what I feel I needed when I was a CT Tech starting out, 3 to 5 years in, maybe some refresher. So I'm going to give you all my knowledge as far as that. So make sure you check out the show notes. There's a link to the Facebook group. Get in on the challenge, guys. It will have replays forever. So make sure you join the Facebook group. Okay. Also, the third day of this live event, I am kicking off my new coaching program. It's a 6-month program where I show you how to be a successful CT tech, how to elevate your skills, how to elevate yourself so that you can walk into any hospital and just scan. You can take a higher management position. You can teach just like I do, or you can go into another modality. Also, I also have a brand new course that I'm dropping. It is a bundle of the CT Basics Contrast Media course and the CT Exams and Protocols course as well. That is brand new. So I will be dropping that probably by the end of this week. So make sure you check that out. I will leave a link in the show notes. Good stuff. Okay. So there's an application to go ahead and join my coaching program. So it's a 6-month program. The doors will open Friday, August 2nd. So at midnight, the doors will be open. You can go ahead and apply to get into the program. I am taking 10 spots. 10 spots is what I'm going to do, 10 students. So make sure you check all those links out. Get in on the good stuff, guys. Okay. Now, in today's episode, what I'm going to be talking about, and I'm going to be kind of sharing because I think this is really good information as far as our role as a CT tech, things that we can do to improve ourselves, and just making sure we are within the trends and the latest technology. So, from this episode and episodes further, I'm going to go ahead and kind of dive into some of those topics. So, in today's episode, we're going to talk about the world of CT and the role as a CT tech. So, we all know that as CT technologists, we have a very important role. Actually, all in radiology, we all have a very important role where we are the third largest, profession in the entire world. That makes up a large part of healthcare. So, we are needed, of course. We know it, people know it, more people need to know it. So it's really good to get the word out there because our role is very important. So, an overview of the role that we perform as techs is, operating the scanner, making sure that patient positioning is good. Because I know I harp on that on every episode, making sure you know how to use the power injector and get those injection protocols correctly. We review orders to make sure orders are correct. It matches up with the patient's symptoms. It matches up with what we're really scanning and make sure it correlates with the exam protocol that we're going to use. Verifying labs, because, we can't inject contrast with some patients whose labs are crazy high, right? Allergies. Patients who have contrast allergies, that is something that we screen heavily because patients will come in and say, oh, well, I got hot, I have an allergy. We know as technologists that is not an allergy. So we have to screen for all those things to make sure that when we safely inject contrast, that it's safe for the patient and they get a good quality scan. Next thing we do is we make sure we check for prior exams, because if they're going to do a comparison, or if we're doing an extremity, are there x-rays, so we know exactly from where to where we're going to scan, because of course we're not going to guess. So those are kind of some of the things as far as an overview for the role of a CT tech. We get to know the ins and outs. There's a lot of complex things that go on in CT that sometimes we have to think outside the box because all the patients are not ideal. So we also prep, the patients for the scan. Patient centering, we got to get a good quality scan and proper patient care. So what I mean by prepping the patients is educating the patients on breathing instructions, little to no movement, to make sure that they understand that we have to get this optimal quality scan on them, right? And quality scan, making sure you ISO center, patient centering. I'm not going to stop talking about this, you guys. Patient centering is so crucial, okay? Because you want to make sure that those doses are calculated correctly. You want to make sure that we are administering a safe amount of radiation to the patient. Those things are important. And patient care, when patients have concerns, listen. I think we do a lot of talking and not enough listening sometimes. And because we're under high demand, there's so many scans to get done. It's crazy busy. The ER has, over 100 patients, waiting, in the ER. There's 30 downstairs waiting in the waiting room. There's all kinds of factors that we encounter as techs, and it makes our job very stressful. So a lot of times if we take just a few extra minutes and listen to the patient's concerns, we can execute that proper care, right? Now, we know our modality is just in high demand because we see more patients during all of our shifts. I could tell you probably on average, and I'm estimating 90% of radiology exams are usually CTs. Okay. I mean, that's an educated guess, but what I see day to day, I mean, there's a high percentage of x-rays, of course. There's, a percentage of MRIs, but I can tell you everybody that comes into that emergency room gets a freaking CT scan. Every single one. They may get an x-ray, a CT follows right along with it, right? So our role is also important for diagnosing medical conditions. Like when we see something and we know we have to alert the radiologist, that is our job to make sure that we are up to date and up to skill with our anatomy and physiology. Those things are very, very important when it comes to being in that role. You have to know what you're looking at. And that comes with experience, and education. So those are things that are really critical, especially if the patient is really critical and we have to get that information to the radiologist right away. Now, we all know as far as skills and qualifications, we all go through the same 2-year x-ray program, right? I know there are some bachelorette degrees that is a 4-year program, depending on where you are and what state and which university college you go through. Now, of course, working in CT, you have to be a registered radiologic technologist to begin working in CT because you have to be registered, right? Also, there's a lot of facilities that now won't hire anyone unless you're CT registered. Other facilities will give you 6 to 12 months to take the test so you can stay on board. So it really depends on what facility you work at, where you choose to work at. They have their own policies and procedures. But of course, we do go to x-ray school, and you can't get to CT without going to x-ray school. Now, there are some techs that do go through a CT program, whether it's a college-based program, a university program, to be registry eligible. So they can go ahead and do the clinical rotation, get their 125 exams, and they go through the pathway that way. Now, there are some techs like myself where we cross-trained on the job. When I started CT 21 years ago, I actually got paid to cross-train. Now, I know there are some facilities that do still pay to cross-train on the job, and there's facilities that you have to come in on your own time and it's unpaid. So there's kind of different ways of how to go about it as far as being registry eligible, gaining knowledge in CT, and making sure you know exactly how to get those optimal quality scans. So those are kind of some pathways that we have as far as how to get your training executed and making sure you get your training properly. Now, one thing I am going to stress is strong communication skills and attention to detail is really necessary in CT. Now, what I mean by strong communication skills is that we make sure that we communicate with the patients in a way that they can understand. So sometimes we have to talk to them like we would talk to our children because they don't understand a lot of mumbo jumbo when it comes to medical terms. Okay. You have to take out all the medical jargon and talk to them in a simple form and listen to them if they have any questions. So, what I do is I explain everything to the patient so they understand as far as contrast, what they're going to feel, how long the test is, if they have to hold their breath, if they have to put their arms above their head. I communicate all those things to the patient right away. The second thing I do is before I even start the exam, I ask the patient if they have any questions and I wait because sometimes they do have questions. And if they don't, then we go ahead and proceed. And then when we're done with the exam, I ask them how they're doing, if they have any follow up questions that I can answer. And usually the patient goes back to the ER or they're on their way home, right? As far as outpatient. So communication skills are really important. And also communication with your coworkers, because if you have to collaborate on this case together, you both need to be on the same page. Also communication, with physicians, with the radiologists, as far as attention to detail, making sure that if you see something like a PE, a head bleed, that you alert the radiologist right away so they can alert the ER. So the radiologist can look at it, dictate it quickly, and get that report to the ER. Now, another thing that is important is continuing education. It's always very good to stay up to date with the latest trends and the latest advancements when it comes to CT because things are constantly evolving. I know there's a lot of talks, there's been talks for the last 10 years about AI and AI integrations. I know we use a third-party AI software when it comes to strokes where it takes the extra work off of our hands where the AI, the images are run through an AI program and then it pops out the perfusion maps. So we do use a company that does use AI technology when it comes to that. And we're probably going to use more AI integrations in the future, considering that we're getting a new scanner that has that capability. So it's always good to get in the know. There's spectral CT and there's all these things that are always evolving, and it's always good to keep your skills up. Now, we know the day in the life of a CT tech, we know that all cases are not simple. We deal with some of the most complex cases when it comes to pediatrics, when it comes to contracted patients that you're trying to get an abdomen and pelvis on, when it comes to patients who are altered, they have dementia, they have Alzheimer's, and they're not aware of where they are, intoxicated patients, ICU patients, trauma, patients who are unresponsive and intubated. Those are the things that we encounter, and it makes us think outside the box on how we're going to get the scan. Not perfect, but how we're just going to accomplish the scan so they know what's going on with the patient. So we know the day in the life is a very stressful one because we're very busy. We have a high volume of patients and it's fucking nuts. Okay. In a nutshell. So there's also opportunities to grow, if you're a CT technologist. I mean, I can give you a few examples. You can go into another modality. I've seen a lot of CT techs go to MRI. I've seen a lot of them go to IR. I've seen quite a few of them sign on to, these vendors, like they go to Siemens, they go to Philips, they go to GE, and they go ahead and do clinical apps. I've seen other people go into management. that is an option. I've seen people go into education, because now, since there's a lot of people retiring, from the education sector of, these radiologic programs, they're going to need more educators, guys. Okay. Like myself. So it's a great opportunity to teach the incoming generation on just, being good technologists, right? Or I've seen a lot of techs, they're travelers. It's not only for nurses, travelers. We actually we've had a few travelers in my hospital, and one of them just finished her assignment. I'm not sure if we're going to get another one, but there have been some pretty good techs that were travelers, and they were from different states. And I'll tell you, there's a couple of them I just enjoyed working with them because they're awesome people. So traveling is an option. If if you want to make more money, there's a lot of money to be made when it comes to traveling, you know? So you just have to make sure that your skills are up to date, that you can walk into any hospital and sit down and just scan, right? So, what is in the future of CT? So, we know AI integration, that is a big, big thing. And that is something that is being pushed. There's spectral CT, there's new applications that are getting created all the time, and they're being introduced. And the ability to adapt to some of these new trends is very, very important. Okay. Because I know that as far as AI, I'm not very knowledgeable as far as AI integration when it comes to radiology, but we're starting to see it more and more where I work as far as what we do with our clinical workflow. So, we just have to get used to it, because that's the wave of the future, and that's probably going to be the standard norm at some point. Okay. Still need human touch, but AI seems to be taking over a lot of things nowadays. So that is what I have for you guys for this week. So I hope all these points that I kind of touched are pretty relevant as far as the role of a CT tech. So I'm going to go into another topic next week about how, CT as a whole, as a profession, we're just constantly growing, and just, the things that you see and that we need as technologists just to be more successful. Okay. So make sure you guys join the live challenge, or the live event, excuse me, not challenge, live event. Make sure, if you're interested in coaching and joining the program, so you can elevate your skills and take a traveling job and make more money, so you can walk into any hospital of your choosing, fill out the application, apply to the program. Doors open on Friday. Also, make sure that you guys stay tuned. Follow on Instagram at the CT Educator, because I will be posting some stuff. Make sure you get on the email list as well. So I always have something great for you guys every single week. Okay. So thank you so much for listening and joining me on this episode. So I will chat with you guys next week.